Should you be taking supplements? Maybe. I don't know. Let's talk about it. I'm Dr. James Monroe. If you are watching this, then you have at least some interest in learning about health or taking your health into your own hands, and that is fantastic. But finding out where to start can definitely be pretty tricky. Maybe you have a friend who, for lunch, they have like 15 capsules and that's all they do, and they're convinced they're going to live forever. Or maybe you're of the camp and you don't think that supplements really do anything at all. And you just kind of want to make sense of things and figure out if you should partake in this supplement craze that's going on. Each person is different, each supplement is different, and so you have to take a lot of things into account before you make any sort of decisions on how to proceed with your healthcare. I know Joe Rogan is saying that everyone should take 5,000 IU of vitamin D. And I might mostly agree with that, but there are people that if they take 5,000 IU of vitamin D, they will become toxic with too much vitamin D. And then on the other end of the spectrum, we have B12. And there are plenty of supplements out there that have like 150,000 times the amount of B12 that you would need in a day. And those are generally mostly pretty safe. So you have to take each supplement into account and then your situation into account. Here are 5 questions you can ask yourself before you decide how to move forward. Number 1, what is your goal? Energy, sleep, memory, addressing a disease state. A really valid starting point is a goal of just wanting to feel better. Any of these are fine and can offer you a nice starting point. Number 2, what does your body need? There is rarely a simple and straightforward answer to this one, and really this is where a doctor comes in handy. Testing is a really helpful way to figure out what your body is needing, but finding the appropriate tests, that's an art in itself. Also, frank nutritional deficiencies can come along with symptoms or even low levels of nutrients in your body. It doesn't have to be a deficiency. Certain symptoms can come along with that. So things like chipping, cracked fingernails, or like muscle cramps, rickets. These are all things that are caused by nutritional deficiencies and can point you to the right things. Usually things don't happen in isolation, and it can be really difficult to peel back all the layers and figure out what is contributing to what you're experiencing. If you have a disease state or a symptom or a situation that you'd like me to talk about, leave it in the comments below and we can make an entire video about it. Number 3, is it safe? Like I mentioned, each supplement is different. And even if you're just taking a simple nutrient, you can overdose on a simple nutrient. Heck, you can overdose on water. So being able to determine what might be safe and what might possibly be risky is important. You can take risks potentially, but you need to know that you're taking these risks. So just going to the store and grabbing DHEA or vitamin D, these are real therapeutic agents that have real consequences. Can be super helpful, of course, but they can cause some damage, so you have to be very careful. Additionally, you might be pushing your own biochemical pathways too hard, and that could lead to some unintended consequences. Before you make any decision to take any supplement or any medical intervention at all, it's important to determine its safety in your body, not in general, but for you specifically. Number 4, why does your body need it? If we can identify what's going on in your body and why you need the thing that you need, then we can solve the problem and you don't need to take any supplement for the rest of your life. Maybe you exercise a ton, or you sweat a lot, or maybe you have an infection, or maybe your GI tract isn't absorbing the nutrients that you're actually eating very efficiently, or maybe you have a genetic defect, or maybe you're taking a medication. The possibilities here are endless. And this actually brings us to what might be the most difficult question to answer. Number 5, can you get what you need without a supplement? This is where you might have to take a long, hard look in the mirror. Supplements can be incredibly helpful. They can support profound beneficial changes in your body, but no amount of supplements can overcome a diet full of highly processed foods, or a sedentary lifestyle, or no sleep, or not caring about your health, or a negative attitude. These are things that have to come first. The best, highest yield supplements on the market, what they really do is mimic what happens when you exercise or eat a nutrient-dense diet. If you're looking for a supplement that will just solve all of your problems, but you're not putting any effort into any other aspect of your health, you will most likely be pretty disappointed with the results. Supplements aren't usually the solution, although they can be. But typically they are a helpful tool. If you can find the right supplements and you combine that with a solid effort to make healthy choices on a daily basis, it will absolutely transform your life. Leave a comment below if there's a specific supplement or disease or health topic that you'd like to hear me talk about. And if you enjoyed this video, click the like button and subscribe to this channel. I will be making a new health-related video once a week. However great today is, I hope tomorrow is even better.